The single most important parameter which decides the success of any couple undergoing IVF is the age of the woman. And when a woman is trying after the age of 40, it is definitely a big challenge. There are many problems associated here. First of all, we have to understand that every woman is born with a stock of eggs which remain constant. They are utilized right starting from the puberty every month, and this stock very often starts depleting after the age of 30. After the age of 35, it starts depleting even faster, and very few times there would be very few women who would have a good stock of eggs after the age of 40. Mostly the eggs would be all over and very few would be remaining. We very often do a blood test which is called Anti-Müllerian Hormone or AMH, which helps us to understand what is the stock of eggs that is left in the ovaries. Very often we see that after the age of 40, the AMH levels are very low. And unfortunately, there is no way that we can replenish these eggs. When we are doing IVF, we are trying to make embryos from the eggs by injecting a good sperm inside the egg. Now, if the number of eggs is less, obviously the number of embryos formed would also be less, because very few eggs will have the capacity to multiplicate and form embryos. We grow the embryos till the stage of blastocyst, that is day 5 of the life of the embryo, and very few eggs can have the capacity to develop very well and become blastocysts. So the success rates of IVF in the age group 40 and above is very often only about 25 to 35%. And there are some other medical illnesses that may have set in older women. The effects of diabetes, the effects of high blood pressure, and the incidence of fibroids and sometimes endometriosis can also be detrimental in the quality of the eggs that are produced. So it is very important nowadays that we are educating women that all those women who want to postpone their plans of pregnancy should think of freezing their eggs. Because when we are doing IVF for women in whose eggs are at the age of 40 and above, very often such embryos may land up having some aneuploidies, which is chromosomal defects, and that is the reason that the incidence of miscarriage is also much higher in these patients. But we do very often process called as embryo pooling, in which we do IVF, the pickup of the eggs, not once but maybe 2 or 3 times. We don't overstimulate such patients, and we try to be as natural as possible, and we go on accumulating eggs and making embryos, and then finally selecting the best embryos and inseminating 2 good blastocysts, which definitely gives us much better results. And of course, the last option, if nothing works out in such patients, remains that of going for donor eggs. But overall, IVF has been a great boon for all women who are trying pregnancy at the age of 40 or above. Thank you.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.